In this video, I want to share the importance of a proper evaluation and workup of those who suffer from chronic pelvic pain. As you know, chronic pelvic pain is super common, and it needs a full assessment if we're going to do the right job. Sometimes, as clinicians, including myself, we get focused in our little bubble as to what we think is going on. As a gynecologist, I was taught to think that everything originated from the uterus or the pelvis. But having done this for over 15 years, I realize that we have to think of the whole person and their whole experience. What is a proper evaluation? When you see your healthcare provider, they should go over your entire history, your medical background, any past surgeries, in order to characterize what kind of symptoms you have. They may go into further detail. It's so important to know when the pain occurs, how it's related to your period if you still have periods, and where the pain occurs and to what level or intensity. Thereafter, it's important to do a really good detailed examination. And that's an exam from head to toe. You need to look at the whole person and their whole experience. It's very important to remember that our bodies are made up of different layers, all the way from the skin, the muscle and tissue underneath, and then what we call visceral organs, or organs inside, like the uterus, the bladder, and the bowel. But along all those layers, there are a ton of nerves and other sources that can generate pain. It is so important that an examination, when done properly, starts at the skin level. If there's pain that's resulting from gentle touch, that's called allodynia. That's not normal, and then we need to think about why that pain is occurring. Deeper touch and examination helps elicit pain even further, but we're also trying to rule out any other concerning things like masses or tumors. A pelvic exam is also essential, but includes, again, that gentle touch of the muscles and the tissue around the pelvis before we go in to examine the uterus, the bladder, and the bowel. With all of that information, a good history, a detailed physical exam, imaging is very important as well. The basic imaging we all suggest we start with is an ultrasound of the pelvis, unless during the examination there were other signs that there were other issues going on. So ultrasound is a very important start, but as mentioned in one of my earlier videos, it may not be the answer because it depends on where you have it done and with what expertise. What other things should we think about when we consider chronic pelvic pain? Well, I'm a specialist in endometriosis and issues that deal with the uterus and pelvis, so of course we think of the pelvic organs, like endometriosis, adenomyosis, and uterine fibroids. Ovarian cysts that may rupture or twist, called a torsion, are also part of that. But I encourage everyone to consider that pain can occur from other areas. One of the biggest things that we see are pain from nerves that are trapped, from hip problems or back problems, all the way to gut issues or bladder issues. So when we see a patient who has pain, we need to examine and evaluate all of that, and we may need to get other services involved, like a urologist or a gastroenterologist. In summary, pain can be super complicated, and it's so important to have a full evaluation. It's very unlikely that there's one answer for everybody. Your experience is unique, and your providers will work with you to decide on what is the best option for you, depending on the history, the examination, and imaging done. I hope that was helpful.